And so I kept doing this for, like years. And like, I didn't go to any parties. I had a couple friends, but I didn't like spend that much time. I spent a little bit of time with them, but like not that much. And then I remember that there was a girl I wanted to ask out to prom, but like I was too scared to ask her. Like I was like, oh, I'm too scared. Like, oh, what if she says no? Like that kind of stuff.
Right.
And then this other guy asked her out.
Oh no.
Yeah, and she said yes. So I remember like being like I vividly remember being at prom and like seeing this girl that like I wanted to ask, but now she was dancing with this other dude. And so I remember sitting there, I was like, oh my gosh. And and so I just had that realization where I was like, okay, like things have to change or else my life is just going to be this way.
Hello, everyone. Welcome back to the Ritik Singhani podcast. My guest today is a child, adolescent, and adult psychiatrist. He got his medical degree from the Whitting College of Medicine at the University of South Alabama in 2019 and has been practicing since for 5 years. He now works for Amen Clinics at their New York location and shares his mental health expertise on social media to an audience of 300,000 plus people. Please welcome to the podcast, Dr. Agam Dhawan. Agam, thank you so much for coming on. I was really excited to have this discussion with you.
Yeah, thanks for having me on, man.
Absolutely, dude. So first off, one burning question I have for you is I know that psychiatry and psychology are often used interchangeably, but I do know they're different. Could you expand on the difference between psychiatry and psychology?
Yeah, absolutely. So to become a psychiatrist, you go to medical school. And so in medical school, you learn anatomy, physiology, pathology, the heart, the lungs, the kidneys, all of that. And so then with all that foundational knowledge, then you go into psychiatry residency where you train in learning the mind, medications, mental health conditions like schizophrenia, bipolar, depression. And so you learn about addressing them from a biological and medication perspective. A psychologist is a therapy degree. So psychologists go to PhD school. And so they get their degree there. And so they learn more either research techniques or therapeutic techniques. So the expertise is a little bit different. And usually as part of a clinical team, a psychiatrist and a psychologist will work together.
Oh, okay. Interesting. So maybe you can clarify this then. Is there a hierarchy, not necessarily in terms of importance, but like, is there a hierarchy in which professional a patient might see first? Is it that you see a psychologist first, and then you work your way up, and if all else fails, like the psychiatrist, like the final boss, so to speak, like you go to the psychiatrist when all else fails? Is it? Am I hitting on that right?
Yeah, that's a good question. So, for example, I just had a patient yesterday, and this patient, they are coming in for ADHD evaluation. And so this patient has been seeing a therapist for like 4 years. They're 16 years old. And so they tried, various therapy techniques. Mom was very kind of anti-medication, that type of thing, but it wasn't working. And so the patient was still struggling in school. She was still like her attention was not able to keep on lectures. And so then she was like, okay, I need to see a psychiatrist. And so that's like the next level step, right? Because you want to try like the holistic measures first before jumping to medication usually. But we have the other way around too. Like I've had patients who come in and they're like, okay, um, I want to start medication for this because, I want to address this as fast as possible. And then I might refer that patient to a psychologist or a therapist as part of their treatment.
Oh, interesting. So it's not necessarily uh, one direction up. Sometimes you might even, as a psychiatrist, refer them to a psychologist if the medication might take care of the problem, and but then there are other issues that they need, but they don't need your expertise. They could or your domain of knowledge. They can go to the psychologist for that.
Exactly. And plus, because, our expertise is with the medication, the biological treatment, using supplement, integrative approaches, right? And so that they do some of that too, but really the therapy expertise is like using the psychological stuff, altering mindsets, using different techniques like cognitive behavioral therapy, dialectical behavioral therapy, et cetera, which they're much more trained in than we are to help the patient with their outcome.
Gotcha. But do you guys ever, as psychiatrists, ever use those holistic research techniques as well?
Yeah, all the time. So it depends, right? As a psychiatrist, you are the treatment team leader. So you coordinate the treatment team. What that means is that you have a patient, I have to know that stuff. So if I have a patient who is, I diagnose with borderline personality disorder, I have to know that I need to refer that patient to dialectical behavioral therapy. It's not just seeing a therapist. If I have a patient who I diagnose with obsessive compulsive disorder, OCD,
Mhm.
I have to refer that patient to exposure and response prevention therapy. So I have to know the right type of therapy that will fit for that patient. And so we're always the ones who coordinate teams too. If you go
Interesting.
to any kind of hospital, for example, like there's a patient who's admitted to the psychiatric hospital, they, the treatment team leader is always a psychiatrist. And so we direct, okay, they need this therapy. They need to go follow up at this social workplace. They need, this type of lifestyle intervention. They need to get discharged to a residential, whatever it is. Like the psychiatrist is the treatment team leader because we have the most training and exposure of all the interconnected things of a patient's care.
Gotcha. And are there any situations where you would have a therapist and psychologist come in? If is basically it just sounds like if it's like less grievous than uh, what you guys might have to deal with. So, for example, if I may, if they're dealing with a person whose schizophrenia is somewhat mild, the psychologist could handle that. But then if it's very severe schizophrenia, the psychologist might be okay. Like I need to refer this to the psychiatrist, the boss, so to speak, before this comes down back to my level. So, like I said, it's like we kind of previously just discussed. Is it goes kind of back and forth.
Exactly. All the time, right? It's teamwork. It's imagine if you have a patient who gets shot in the leg. They need physical therapy for sure, but they need the surgeon first, right? So that's the team approach. Or if now somebody has a leg cramp, physical therapy might be enough for them. They don't need a
Yeah.
surgeon to fix that. And so that's why there's higher degrees, like there's levels to it.
No, that's great, man. I was under the impression that it was a sort of hierarchy you had to climb, but that's actually far more interesting and nuanced than my previous assumptions. So, dude, when we connected last year, you really grew my interest in psychiatry, and you educated me on how impactful psychiatrists can be. But I know not everyone shares this point of view. So, story time. I had a experience where I was getting a suit tailored for a wedding, and I was striking up a conversation with my tailor. He was an older gentleman, and the tailor said to me, he asked me, "Hey, like, what do you do?" And I said, "Well, I'm working in the hospital system, and I'm applying to medical school next year." And he asked, "Oh, cool. Like, what kind of doctor do you want to be?" And I said, "Listen, I don't want to necessarily pigeonhole myself just yet. I think that I might go into," and then I gave a bunch of specialties, and because I recently connected you with you at the time, I threw in psychiatry as psychiatry, and he made this face where have you ever seen a kid that grabs a bunch of cookies and he thinks they're chocolate chip, but like he eats it and it's like oatmeal raisin, he scrunches his face up. It's like psychiatry. And he looked at me, he's like, "Does that stuff even work?" And I'm not a psychiatrist, so like, no, I was nor educated, I was not educated enough to really answer that question. And try as I might, I couldn't convince him otherwise. So I'm curious, Agam, what's your response when someone says something like that? Like when says, "Does this stuff even work?"
hmm
Just curious, what would be your response?
Yeah, so I'll tell you a story as well. So I remember I was interviewing for my psychiatry residency. So I was at a program in New York actually, and so I'm sitting there, the interviewer. So the interviewer is a Desi lady, Indian lady. So she's a psychiatrist, and so we're talking, and so she asked me, what does or what do I think? Sorry, what do my parents think about me pursuing psychiatry? And I was like, yeah, I think it's fine. Like there's nothing wrong with that. Because I think the times are shifting. Now, when I go to like hangouts with uncles and aunts, they are starting to ask questions. Like people are saying that, yeah, I don't feel good. I feel depressed, or I feel I get really anxious all the time. Like there's differences, right? So to answer your question, my response would be, well, just like we have heart doctors, lung doctors, kidney doctors, you have brain doctors, and the brain is split into two different things, right? You have the physical side, which is neurology, and then you have the more mental side, which is psychiatry. And so now we're developing more of an awareness of it, and to help, by addressing people's brains, you can help the symptoms that people have. My response would be, okay, if mental health wasn't a thing, then why are people killing themselves?
Yeah, actually, I remember you in passing. You talked to me about a kid you helped prevent their suicide. Actually, it was really amazing story. Do you mind sharing that as well?
Help prevent their suicide.
Yeah, like so. I think if I remember our previous conversation, you told me, yeah, there have been a couple of times. I don't necessarily think it was one patient, but there have been a couple of times where these patients were intent on self deletion, and it was through working with you that they kind of came back from the edge. If I'm wrong, please tell me.
Hmm. Yeah, certainly, right? So I had a lot of experience in the emergency room. And so when you're in the emergency room, what happens is that uh, let's say a family brings in their kid, like a 15, 16-year-old kid, and this kid is having suicidal thoughts. There's one thing where you can have suicidal thoughts, then there's like suicidal intent, then there's having a plan, and then there's actually like taking steps on that plan. So for
Hmm.
example, if there's a kid who comes in and just says they have suicidal thoughts, like, okay, that's fine.
Yeah.
But now let's say there's a kid who comes in and says, okay, I'm having these thoughts. My plan is to overdose on the Tylenol in my parents' basement when they leave for work the next day. And I'm going to take 40 bottles. And I've already written notes to my friends. And I'm going to send out texts right before I do it, so that way they can't stop me.
Yeah, it's very thought out, very methodical. Like they have a yeah. Okay, I see the difference.
So you see the level of severity there, right? And um, so obviously that person's having a problem. And so I remember I had one patient who I saw in the emergency room like that. And then I took them, or I started seeing them as an outpatient. And so, we helped them get started on medication. We helped them get on therapy. This was a 16-year-old girl. We helped them with, we got the family into family therapy to help their relationship. We helped the patient, develop coping skills for school. And then by the end of that 6 months, they said that they were feeling better and they didn't feel suicidal anymore. So it's a combination of all those things, right? Medication, therapy, lifestyle changes, diet, exercise, everything kind of combines to get someone the ideal outcome.
Absolutely. Oh, that's amazing. And I'm sure, like, so, like I said, you've been practicing for 5 years, so I'm sure that's not like the only story you have. So the funny thing about, my podcast is that I'm kind of exploring the medical field. I'm not even in medical school yet, so it's been a really great opportunity for me to talk to people like you, who's as knowledgeable as yourself, who have been practicing for so long, to get a real feel of what I might want to do with my life once I get into medical school. So I tend to watch a lot of like medical school influencers or medical field influencers online to kind of see
Uh-huh.
like what the news and trends are. I've heard from medical influencers online, and admittedly, even my own research mentor. So not just now, it's not even just online. This is actually just people I have direct access to. That compared to other specialties, you mentioned neuroscience, psychiatry is often considered a soft science. And real quick for my viewers in the medical field, hard science typically deals with something that's more tangible. So you can think more along the lines of like biology or chemistry. But a soft science deals more so with like intangible things like thoughts and feelings. Oh, first off, would you agree with that definition?
Yeah, I agree with that.
Yeah. So my question to you is, do the current treatment methods of psychiatry have anything to do with its reputation as a soft science and have anything to do with the reputation it has among people that elicit reactions like, does that even work?
Yeah, those are fair questions. So let's address them one by one, right? So to address the thing about the soft science, so that makes sense because we don't have the hard diagnostic tools yet in psychiatry. So, for example, a patient comes in and they're like, or they say, "Hey, I have some pain in my foot." They're overweight. You check their blood sugar, and it's high. You check their A1C, and it's high. So you're like, "Okay, boom, I diagnose you with diabetes." In psychiatry, we don't have genetic markers to say right now that okay, you have this diagnosis, like you have schizophrenia because of this gene, or there's no blood test to say okay, these are the lab values we measure, so therefore now you have bipolar, right? And so now like that's the next frontier in psychiatry where it's shifting. So now with brain imaging, with genetic markers, right? Like those are the biggest two frontiers that we're looking at to change that to where there are objective markers that people can come in. Right now, there's a saying in psychiatry is that you are the diagnostic instrument. So rather than me getting a patient's blood, I can look at a patient and just get a flavor for what they're seeing, right? Even I can talk to someone for 5 minutes and get a sense, okay, like this is an anxious type of person. This is an OCD patient. This is a borderline personality patient. Or they tell me some of their symptoms. I'm like, okay, more, this is bipolar. And then as you start going in, asking them questions, detailed, that's when you can get the full symptom criteria to, make the diagnosis. And it's really important to make the diagnosis correctly or as best as you can in that situation because the treatment matters. How I might treat, right? Because different medications are used for different diseases. So if I try to treat, for example, your depression, but it turns out that you actually have an underlying bipolar, then I could actually spike you into a manic episode by just treating the depression, right? If we didn't assess if you had any previous history of manic episodes.
It's fascinating.
Similarly, right? Similarly, if you tell me you have hallucinations, are those hallucinations from schizophrenia? Are they from major depressive disorder? Are they from an organic brain disease, like an infection? So that's where that really makes a difference, right? You have to have a good diagnosis first, so that way you can find the proper treatment for it.
It's interesting that is interesting that one mental health disorder can actually mask or even it presents one way, but then if you give the improper treatment, it sounds like you could even exacerbate that effects if you're not understanding the underlying like cause, right? Am I
I'll
hearing
give
that
you I'll
right?
give you a simple example.
Yeah.
Let's say you come to me with chest pain.
Okay.
What could chest pain be?
Well, immediately I think heart attack.
Mm-hmm.
Uh, yeah, that's what I immediately think of. As to why you could be having that heart attack, it could be you actually have uh, like necrosis of like the heart, like the part of the heart's dying,
Mm-hmm.
or it could be triggered by theme of this podcast, mental health. It could be triggered by maybe like a panic attack or something. Is that possible?
Mm-hmm.
So, well,
Okay, so now the patient comes in, right? You think it's a heart attack because they have
mhm.
chest pain, and what would you do?
What would I do? Well, I would ask them patient history. Like, do you have a history of heart problems? I would ask them that first. And depending upon their answer, like if they do, then there's more of a chance that it's biological nature. It's or
Bro, they're having a heart attack right now. Like, what do you
oh,
do?
okay, never mind. Well, if they're having a heart attack right now, then uh, I would. I'm forgetting my EMT training, but I would just treat the heart attack as is.
Right,
Just making sure they're stabilized, making sure, yeah, all that. Okay.
right. So you think they're having chest pain, you think they're having a heart attack, so you treat it.
Hmm.
Well, you give them nitroglycerin, right? You
Right.
do EKG and stuff.
Hmm.
Well, actually, because you didn't investigate, turns out it was actually an allergic reaction. They're having
Oh,
anaphylactic, and now the patient died. That's why they're having chest pain, because they swallowed a bunch of peanuts.
so when you relate this to mental health disorders, like you could have someone that comes in with what looks like depression, right? And you might think, oh, they have depression, so I treat the depression. But I think what was the example you used? Maybe they had bipolar disorder is actually what it was.
Mm-hmm.
And so the treatment you give for the depression actually exacerbate, which actually it isn't depression. It just looks like depression. You
Correct.
actually exacerbate the the issues of the bipolar disorder. You make it worse.
Mm-hmm. Exactly.
That's nuts. Oh wow. So how does the field of psychiatry currently diagnose? You said you said that was this one of your mentors that said that you are the diagnostician, or is that just like a saying in the field?
Yeah, one of my mentors said that, but I've heard it just around. You are the diagnostic instrument.
So I know that psychiatrists use something called the DSM-5 to list criteria for mental health disorders. Can you explain what the DSM-5 is and
Yeah.
how this actually might be? Is this a good tool that you guys have that helps with what you guys do, or is there some limits to it?
Yeah, that's a good question. So the DSM-5, so it stands for Diagnostic and Statistical Manual 5. So this is the fifth edition, and basically the way it works is we want to be able to put together someone's symptoms to create a diagnosis. So that way, when I talk to another clinician, I can say, okay, this patient has bipolar, this patient has ADHD, rather than saying that, okay, this patient has trouble focusing in class and, they get up all the time and they can't sit still and it's hard for them to wait in lines, right? So it provides clarity when clinicians talk to each other and when patients talk to each other, and it helps us with treatment.
Right.
But the way the DSM is created, it's not created from an underlying biological basis. It's created from symptom clusters. So what that means is that if you have trouble concentrating, your mood's down all the time, you might have some unalive thoughts, right? You your body just gets slowed. Those symptoms could classify under major depressive disorder. But it's just a bunch of symptoms that classify because those symptoms could also be from, let's say, you have an infection, you're sick, so you could have those symptoms. Those symptoms could be from PTSD, trauma. So you see how there's limitations to it, where it's just a collection of symptoms. We don't know the underlying basis behind it. Some people can have depression that's very agitated, where like they're very irritated, whereas others are very low mood. And so I would treat those very differently, but they have the same condition, right? Because like one is more agitated, so I'd want something that's more calming. The other one has low energy, so I want something more higher energy. Whereas in other fields of medicine, right, if you have an infection, your infection is by Staph aureus, that requires X antibiotic. If it's by Pseudomonas, that requires Y antibiotic. So you see, I can tailor the treatment much more specifically because I know the underlying biological basis.
Right. Whereas if you treat via symptoms, you get the issues we actually just talked about, where you have something that presents as what you think it is, i.e., presents as depression, it presents as a heart attack. You treat it, but it was actually uh, something else.
Correct.
Okay, okay.
So that's the
So,
limitation of the DSM-5. And so, that's kind of the stuff that we're doing at Amen Clinics, right? The goal is to try to develop a more biological basis for diagnosing and treating. And so that's where imaging comes in, right? So it's not perfect by any means. Like we don't have a perfect thing to say, okay, you have this thing, but it's just moving in that direction. So that's the goal of, I mean,
that's
just our
great.
work, and then just as a field as a whole, different people are pursuing different avenues to do this.
So let's actually put a pin in the Emin Clinics thing, because I definitely want to come back to that. But it sounds like what's happening, and tell me from right. So it sounds like what's happening is that you're creating almost like these one size fit all cures, where if I see this symptom cluster, I'm going to treat it with X treatment. Could be a medication. It could be a therapeutic intervention,
Hmm.
like an actual therapy, like a cognitive behavioral therapy. But whatever. I'm going to treat it with X. It's what it sounds to me is like you're creating these like one size fits all cures instead of like tailor made approaches. Is that am I on the right track there?
Hmm. Yes, but that's what separates a outstanding psychiatrist from an average practitioner, right? The average practitioner just goes by the algorithm, like symptom to cure or symptom to treatment. When you get more advanced in your field, or as you get higher level training, you start to put together the person's whole picture. For example, I just had this patient the other day, and this patient has had 18-year-old guy. He's had treatment resistant OCD, and basically with him, he has tried some medications that haven't really worked, and this guy is terrified of doing anything. Like he doesn't want to try any more medications now. He doesn't want to do any kind of therapy. He feels like nothing's gonna work. It's all hopeless. His mom has sent me audio recordings where he's like crying and screaming and just howling, like, "Oh, I'm gonna die. Like this is gonna happen, and that's gonna happen. I'm a failure." That kind of stuff. And it's been quite honestly very challenging to help him because he doesn't want to do anything. But we have been doing all these sorts of evaluations, right? He's been open to at least doing more diagnostic testing. And so I've referred him to one of our integrative providers. And so she did a lot of like, infectious blood work. And so it turns out that this guy has he's got a strep infection. So there's a thing called it's called pandas, where basically it's like if you have a strep infection, that can cause chronic OCD. That strep infection doesn't get fully cleared, and it can cause that. So you might not have a sore throat anymore, but you still have the immune reaction to treat that. And so that's a known thing, but it's a rare thing. And so now, so she started him on antibiotics, and he actually agreed to take the antibiotics. And so we're on day 3 right now. It's a 14 to 28-day course. So we're going to see how he does.
I'm curious. Do you think that I've heard this negative stereotype of the field, and it was actually something that they brought up that Taylor brought up a little bit, and I've heard this in like other media where the psychiatric field or even psychology as a whole, they get this unfortunate stereotype of being like a pill pusher. Now I know you like I personally, and then that's not what you've described to me. You actually guys are being very nuanced and very careful about how you actually pat medications. But is that stereotype due to just not understanding, or as you said, actually that's what the average quote unquote psychiatrist does versus people who become like more high level in the field. They've taken into account this biological the biological aspects. Is am I on the right track there for that?
Hmm. So your question is, why is the pill pushing a thing?
Yeah, yes. Why is that a thing? Because it's unfortunate because I think that the field is wonderful, but I hate that uh, this shroud is kind of over it.
Yeah. So there's multiple reasons to that, right? One is that, you have to remember that our expertise is in medication. So you can have therapists who are psychologists, PhDs, you can have licensed mental health counselors, you can have master's level clinicians. Hell, there's like people who are being coaches, right? Saying that they're therapy or life coaching or whatever, right? A whole bunch of people can do that. But only a psychiatrist can treat with medication because they've gone to medical school. And of course, like nurse practitioners and PAs and stuff, but that's a new thing. Um, so that's where our expertise is. And so for us to practice at the top of our license, that's where our expertise is the most helpful. It's not really, if I decide to do therapy, everyone else can do therapy. So it's not worth my time. And, it's not even helpful as much to the patient unless I'm an expert at it. But then if I'm doing therapy, I'm putting away my medication knowledge and my diagnostic knowledge, right? For the helping the most severe cases. So that's where they get that reputation, right? The second thing is that the insurance model gears towards that. So, for example, like right now, my intake, like for my private practice and just the work I do, so my intake is 2 hours long, and my follow-ups are 30 minutes to an hour. But I don't take insurance. For patients or for people who are on insurance and they go to insurance providers, for example, I worked at a community mental health clinic. And so in this community mental health, right, it serves like lower income, Medicare, Medicaid, that type of thing. Our evaluations, full evaluations, were just an hour long with like no previous history. And our follow-ups were 20 minutes long. And it's like a churning model, right? The more you churn out, that's how the practice makes money and stays afloat. So therefore, I'm incentivized to see patients as quickly as possible, right? And to make an executive treatment decision in that immediate moment, what the best medication that I think I can use in that like 20-minute follow-up.
Right.
So that's a huge reason why too, because most people are only, if they seek out psychiatric care, they only get exposure to that level of experience.
Gotcha. And in those 20 minutes, like, how are you able to explore some of the many nuances we just discussed in the past, like 30 minutes? I imagine it's pretty hard, if not impossible.
Yeah, you're not.
Yeah. And so you're almost incentivized in the sense that, all right, let me just give him the pill and then move on to the next person. I can understand how that mentality can develop.
Mm-hmm. Yeah, absolutely.
Okay. But going back to the biological like aspects, biological foundations of psychiatry. So, what are some markers or some uh, things you guys take into account when you're looking at someone's psychiatric diagnosis? Like, is it due to diet, age? Like, what do you guys take into account?
Could you clarify that question?
Yes. So, what are qualifying characteristics, biological characteristics that you guys take into account when you guys are looking at why someone is suffering from a mental health disorder?
Got you. Yeah, so age and sex are two big ones, right?
Okay.
So for example, let's say I have a 16-year-old kid, and this kid comes to me, and the mom is like, he's been withdrawing a lot, he's dropping out of school, he is not taking care of hygiene anymore, he's getting into weird Illuminati type of stuff, right?
Yeah, they're having
So that makes me think about, okay, is this person developing schizophrenia? Because the most common age for that to develop is from 16 to 25. Now, if I have, let's say, a 50-year-old with those symptoms, then I'm like, okay, I don't think it's schizophrenia because he probably would have developed it by now. Or let's say I have a 60-year-old. Then I'm like, okay, is this more signs of dementia? Is this an infection? Is this a medication reaction? For example, I had a 65-year-old guy who he was coming in and he said he was hallucinating. He started seeing like little gremlins, on this garage door, and they were talking to him, and this started maybe like a year or two after his brother died, or it started soon after his brother died, and it had been a year or two since then. So now I'm thinking, okay, is this a grief reaction? Is this some kind of delayed psychosis that he's developing? But his age was 65. And he had been on this medication, amitriptyline, Elavil, for 20 years. That medication has a property called anticholinergism, where like you probably heard that you don't give Benadryl to old people. So it's a similar thing with that medication. So it helps people sleep because of that. And it's fine when you're 30, 40, 50. But as you get older, your brain isn't able to tolerate that as well. And so people can develop psychotic symptoms like hallucinations. So I suspected that. So I took him off, slowly weaned him off the medication. 2 months later, he's in, all those symptoms are gone.
No gremlins, not like nothing.
Nothing.
I like how you really like thought through what it could be. You first took like you pieced it apart, kind of like almost like a detective,
Mm-hmm.
where you have to think about, okay, they say they or was it did he come in with that patient? Did he come in with his was it a spouse or a mom or what was it?
No, he came in by himself, but his brother had died a year or two before.
Gotcha. Okay. No, but I really liked how you pieced apart that case because it just goes to show it just goes to show actually the level of your training. We talked about this actually just a bit. That's the level of training you guys, the diagnostician training you guys bring to a mental health issue.
Precise. So just to expand on that, right? Like let's say a psychologist or someone in that field saw him, like they could help him. Oh, let's cope with these gremlins and stuff. Which I'm not saying is not helpful, but they don't have that diagnostic level training, right, to identify what their condition is. So that's where the psychiatrist comes into play. Or let's say you have a mid-level provider, for example, like nurse practitioner, or right. So they usually work under us as part of the psychiatric team, but the level of training is different unless that person seeks it out, right? So oftentimes what we see is that, okay, oh, they're psychotic, let's throw an antipsychotic at them, for example. So that might work in like 5 out of 10 cases, but now in this case, right, that wouldn't have worked because
Right.
you have to have that underlying knowledge of like the different medications. So it's just different.
Yeah. Do you think that would have made something worse too?
What
If
would
that
have
were
made
the
something
case
worse?
so if that patient that you just described was given an antipsychotic,
Mm-hmm.
would that have exacerbated any certain symptoms or issues that he was experiencing? Do you think it would have, or do you think it would have been more of a band-aid? Like it may have reduced them, but didn't solve the issue.
Right. So probably both. When you have medications, right, you mix them together, there's always interactions. So you have to be aware of that. That patient was older, so they're more susceptible to side effects anyway. And then, yeah, third, it's like you're not solving whatever the underlying condition is. And sometimes you don't know. So that's when you use an antipsychotic. But, if there is something else, then, right, you fix that.
Gotcha. I know you also said that, so that was age. You talked about a patient who was in their older years, but you
Mm-hmm.
also mentioned gender is also a significant uh, contributor to is a significant trait you guys look into as to how
Mm-hmm.
someone's experiencing mental health disorder. Uh, I can speak in my own personal experience that when I was dealing with any sort of mental distress as a guy, I would usually just do something to kind of alleviate that feeling, just going to the gym or something, or honestly, just not talking about it. And when I felt like I needed to talk to somebody, I seldom did talk to a mental health professional. It was mainly to family and friends. I could probably count the number of times I've talked to like a counselor or a therapist or I haven't even spoken to a psychiatrist in the professional setting. So I can count those times on one hand. And I thought, maybe this is just me. Maybe this is how I process things. I'm sure there might be men who go to therapy more often than I do. But I was actually looking some statistics up because I was just curious. And there was actually a study published last year, and they looked at the number of adults in the United States who they received mental health treatment or counseling in the past year. And it was their year range was from 2002 to 2023. And the results showed that actually women are twice as likely than men to have received mental health treatment in the past year. With I think it's around like 20% of adult women have been receiving some kind of mental health treatment in the past year as of like 2021. That's what the study stated. So, in your experience and practice, how does gender play a part in how people experience mental health disorders?
Yeah, so I'll tell you a story. When I was in a first year resident, I decided to do therapy because I was like, okay, I want to experience what this is like as a patient. And so I go to my therapist, and so I found her from just insurance. She accepted my insurance, and so I just start talking to her about stuff that was up in my life, and like adjusting to residency, like girl issues that I was having, that kind of stuff, and then we'd talk about it. But then I would leave the session and be like, well, that didn't solve my problem. Like, now I just got it out of my chest, but that didn't solve the problem. Like, okay, like for example, I was trying to decide like which girl, like I was going to a wedding, and I was like, okay, which girl do I take on the as my date? And so at the end, I forget what the specifics were, but we talked about it, and then I was like, okay, well, I still need to execute here and make a decision, and so I did. And at least for me, I found that it didn't give me any sort of clarity. And by the end of it, I felt like I was just showing up just to talk, right? Because I said, okay, I'm going to do it for a year. And by the end, I found like I was just showing up to talk. And I was like, well, I just need to take action. Like, I just need to, whatever the issue is, I just need to go and solve it, whether it's internal or external. Whereas women are
Did you
different,
end
right?
up taking the girl you wanted? Did it work out?
I honestly don't even remember.
Yeah.
This was so long ago. uh, yeah, no, I think
Just
I
so
took
sex
like
find attention.
I think I took like girl number one. Um, yeah, but regardless, right? Uh,
Right, right.
yeah, this was a while ago, but I forgot where I was going with this.
That's okay. Well, so a question off of that I actually have is that why do you think women are more prone to seeking out
Oh, I
mental
remember.
health?
I remember where I was going with this. Yeah.
Okay, yeah,
So
go for it.
yeah, so the way that the therapy model is designed is you talk about your problems, and talking is a very feminine way of solving issues. When you get together with your boys, right? You don't just sit and
Yeah.
talk. You don't ever meet up for lunch just to talk, or you don't ever meet up just to hang out. You don't have sleepovers just to hang. It's like, okay, like for example, me and my friends, okay, we're going to game together, or we're gonna go watch a game together, or we're gonna go, work out together. Like, we're always doing X or Y, or we're gonna go to, the pub together, whatever. It's always X or Y activity that we're doing together. So for us, it's like the activity comes first, and then like the bonding is kind of comes through the activity. Whereas for women, it's like the talking, the communication comes first. The activity is almost frivolous. So when you look at a therapy model, a psychiatry model, it's all based on talking. So from that, women just have their natural propensity to it. It makes more sense to them. One, more therapists are women, and so as a guy, I fear that a woman might not be able to understand the issues that I'm going through, and vice versa, right? So if we know that 70-80% of therapists are women, so they get sought out by women. So I think that's one thing. There's so many factors. For example, for a women, there's no slight or shame if you are getting diagnosis or treatment with a mental illness, for example. But for men, there is, because as guys, we have to perform, right? Like we have to be adequate. It doesn't matter if I have an illness or whatever. Like if I don't show up to work, then like, my family's not eating, right?
Yeah,
Or,
the bills
if
have to
I,
be paid.
yeah, the bills have to be paid, right? If I start slacking or at least like mentally not being well, then I'm going to lose respect from either my girlfriend or from my, um, friends or whatever, right? I'm going to lose attraction. And so it doesn't matter what you think it is. That's the reality. It doesn't matter what you want it to be. That's just the fact. So now it's like, how do you adapt with that reality? Well, guys start looking at other coping strategies, right? Like alcohol, substance use, that's a big one. Video gaming, that's another one. So guys tend to turn towards numbing a lot, um, because
Interesting.
they don't tend to seek out like the care that they need.
Uh, I wonder. So you mentioned how there are majority of it. Actually, I want to make this distinction with you. So is it majority of mental health professionals overall, or is it like in psychiatry like specifically that is there is a majority of women in the field?
Yeah, it's a majority of women are in all of mental health, psychiatry,
Okay.
therapy, all of that. Yeah, well, it tends to be a more like a feminine leaning field, right? Like just like talking, emotion, touchy feely, right? It just tends to draw
Yeah.
more women. I know that for my makeup, like I'm more that way too. Like I tend to be more empathetic. I understand people's emotions. I'm the type who like cries in movies. Um, like I remember like when my friends would have a breakup, right? Like I'd be the one like, at their house, like in college, for example, like hanging out with them after the breakup, right? So like it's like stuff like that. So I kind of had that natural uh gravitation sense there too.
Yeah, I can absolutely relate to that. I have been usually the person to be someone to talk to in my family.
Hmm.
I definitely think that I am much more, if I fall on the spectrum of empathy between my mom, my dad. Obviously, my mom's going to be was the more empathetic, more emotional one, being a woman. But then my dad, at least from what I saw of her, but then my dad, being the guy, the man in the relationship, he created like a very uh, stoic role model for my brother and I,
Hmm.
and that came with displaying emotions very differently than my mom did.
Right.
So growing up, when I was younger, I gravitated a little bit more towards how my mom did. But then as I grew up, especially after my mom passed away, my dad essentially told me like your childhood is over. You don't get a luxury of that, and you get have the luxury of having. You don't have the luxury of having to. Uh, how would you say? Uh, Needing to like you can't cry about this necessarily. He didn't say don't talk to anybody about this. He actually made sure that I got counseling if I needed it. But he's like, no
Uh-huh.
one listen. It's sad that this happened to us, but no one's gonna care. Ultimately, everyone has a life that they have to live, and only for so long can people be feel sorry for you. So you need to make sure that you also are picking yourself up, and you gotta move on while at the same time getting the help you needed. My dad was balancing that, but yeah, so very different ways of expressing emotions. So I relate to you though, is that even being an adult and still and kind of falling more towards the stereotypical stoicism, I still think that I'm of my peer group a little bit more empathetic, a little bit more emotional. That might also be because I'm 24, but as well.
Right. So if you're familiar at all with Carl Jung, basically he talks about like the light self and the shadow self, right? That's his um
Yeah.
thoughts. And like, that concept is all in different philosophies, yin and yang, right? Heads or tails, like there's always the Gemini astrological sign, right? Light and dark.
Mhm.
So similarly when it comes to right, stoicism versus emotional, right? There's like, either you're one or the other. Well, the enlightened person is both.
Right.
They integrate those aspects, right? It's only a fool who says, right, either they're all good or all bad. Like you have to understand your dark self, and sometimes that gives you the best motivation, right? So that way you
Hmm.
can do good in the world. So similarly, like I'll give you a story. So my dad is that classic so basically we were coming back from so we'd gone to India and we came back, right? And so during that time it was about a month, and my parents' neighbors had watched our cat. So, my mom was like, "Hey, we should get him like a gift or something to for that reason." So we said, "Yeah,
Yeah.
sure." And so my dad one day he picks up a gift and he stops by after work and he gives it to them. My mom finds out and she gets mad. And she's like, well, like I wanted to be there to give them that gift, right? To know that, like, I was a part of this too. And my dad was like, oh, well, the important thing was they got the gift. And so I had the free time and I gave them the gift. And so she got up and so she was like, no, like you didn't understand. Like, I wanted them to know that I had given it and that I was a part of this. It wasn't just your idea, right? And I wanted to express my thank and gratitude for him too. And so now, as the son, right, like I've seen this kind of dynamic growing up, I can relate to both of them. Like I understand both of their perspectives from my dad's masculine perspective. Like, yeah, this was the task. Let's just get that task done. But from my mom's perspective, the social aspect, the perception aspect, right, the emotional aspect of being the one to do it, like those are important too.
Right.
So I think that like integrating both those perspectives has helped me in my career as a psychiatrist because I have to be able to connect emotionally and have patients feel comfortable with me, have them be able to understand body language if they're upset or not, right? Or like little nuances if they like the treatment plan, pick up on things that maybe they're hesitant about sharing. But then I also have to have that more masculine style of thinking where, okay, like this is the decision. We're going to make this decision. Okay, we're going to be logical about this. I think this is better than X or Y because of this. We're going to do detective work to get to the bottom of stuff.
Hmm.
So it's combining both of those things that really makes for an like then outstanding psychiatrist. So no, I think it's super important to combine. Then I think that the integration of all those aspects is what separates people.
That's so funny you mention that because my mentor also has a saying where he calls it being an integrated man, where you it's the person who keeps the emotions stuff down and doesn't actually take time to analyze and chew on them, so to speak, and really understand why they're feeling the way they are.
Mm-hmm.
That ultimately it's like a volcano, right? You stuff it down, and then if you don't address it, years and years later, it bottles up and usually like an outburst.
Right.
And yeah, so that's really it's really interesting you said that. So I want to go back to the when we talked about how there is this overwhelming majority of females mental health professionals. So I know we discussed how uh, the how men and women they are treated in therapy differently and how they approach it. But I'm curious. So if like we said, like how the actual treatment is being uh, given, and depending upon what the gender is. So actually, I was looking up some statistics. So the American Psychological Association states that women make up, I think, 76% of new psychology doctorates, and then 74% of early psychologists are women, and then 53% of the psychology workforce are women. So I think what's interesting is that when you have 53% of the current workforce doesn't sound like a whole lot. It's like, all right, that's only like 47% are men, 53% are women. Okay, that's great. But then when you have more and more doctors that are being given out and majority of the coming mental health professionals are women, do you think that is going to affect how the field of psychiatry views and treats male mental health disorders compared to female mental health disorders?
That's a good question. Yeah, absolutely. So right now we're seeing that The therapy model is very the talk based, right? So that's one thing. We're also seeing men's mental health on, or one as a big talking point, but also like male loneliness, male sexlessness, right? Uh, Male almost like fragility, male video game addiction, pornography addiction. All of these things are skyrocketing. So I think yeah, all of that's definitely going to compound. If there's less profession, if there's more women professionals who men don't feel comfortable around, don't feel like they might understand their issues, then um, then yes, yeah, I think so. I'll tell you another story. So I remember when I was seeing my therapist, right? And this was maybe like month 3 or 4 into therapy. And so this was right around like the 2020 presidential campaign was starting to kick off. This was like maybe a year before. And so we were talking about it. And so I was talking about entrepreneurs actually, like, because I wanted to start a business and things. And so what I said was, I really respect how President Trump was able to convince half a country to vote for him despite not having any political experience. Like, that was his strategy. I have no experience. That's why you should vote for me. And he succeeded. So I'm like, there's a lot of marketing that we could, like, marketing genius that we can learn from here. And she just goes, oh, how could you like that man? And I just remember thinking, like, I'm in therapy, and I'm like, oh my god, like, like even like this lady's like 60 years old, right? And I'm like, okay, this is not good, because immediately like I shut down, and I was like, okay, well
Right.
now I can't be honest to her, okay, like that
Yeah.
was the whole point. And so next session, right, she did apologize for that, but
Okay,
the
that's good.
damage has been sure, right, but the damage has been done, right?
It's been done.
I clearly I remember this. And so would she have reacted differently if she was a man? Maybe, maybe not, right?
Maybe.
But the point
Definitely.
is that she was not able to understand how me as a young male, as a 26-year-old male, could look up to someone like that and see someone like that as an inspiration, right?
Okay.
Even though I did not even I didn't even vote that way in the 2016 election, but I could see like that was my inspiration. So she wasn't able to get that, and I do believe that our gender differences play a part in that.
So that's actually what I want to ask you. I want to ask you, is that a learned skill? It's, I don't know what you would label that. I would think that's empathy, being able to put myself in the other person's shoes and being able to understand, okay, why is this person thinking that way?
Mm-hmm.
Like taking into account the context, nuance, and background of their life. And
Mm-hmm.
so, like, why would Agam? How old were you at the time?
I was 26.
26. Why would a 26-year-old Indian guy who's, and then taking into account your life, why would he find, and just being able to put myself in your shoes, is that a learned skill that you can learn in your opinion despite your gender, and does the gender differences that can potentially play a part in how well that skill can be learned? I'm just curious. It's like I feel like it's a gray line in how that can be learned. So
Yeah, of course. So, how tall are you?
I am 5'11", 6'2" on dating apps.
Got it. Okay, so you're 5'11", right? So I'm like
Yeah.
5'6", and so you can learn basketball.
Sure.
I can learn basketball. I could learn like a basketball, and I could be pretty good at it.
Mhm.
And I could probably beat you if like you don't like learn any basketball, or like
Oh,
you
sure.
learn a little bit. But if we do the equivalent amount of basketball practice, you're going to beat me because you have that natural advantage.
Right.
So to answer your question, of course, right? It's everything in life is a skill. Like that's why you have to level it up. You have to know what skills you have and what skill, and you have to put an effort to level those up. So,
Mhm.
of course, a man can learn empathy with female clients, just like a female can learn empathy with male clients, But then you also have those innate biological differences too. And so, it's the best athletes are the ones that combine nature and nurture. Not one or the other, but they have both. So, similarly, right? Like people who are just naturally more empathetic and stuff, of course, would be more drawn to a field like therapy than someone who's not. So, going back to that example, right? Of course, she's been doing it for a long time. I'm sure that she has that skill set, to put herself in the client's shoes. But that was a lapse of judgment in her part for that particular moment.
Yeah. Okay. Wow. I didn't realize how much nuance there was to this field until like I started talking to you. So this is really fascinating. Is that actually why you started working in MA clinics?
Yeah, that's a good question. So when I was finishing up my child fellowship about a year ago, I was looking around to different things that I wanted to do. Do I want to start a private practice? Or I had a private practice. Do I want to fully go into that? Do I want to work in the emergency room? Like, where do I want to lead things? And so I'd already been creating content on social media for a couple of years. And so I'd come across Dr. Amon's videos.
Hmm.
And so clearly, like, he has done exceptionally well in that regard,
Yeah.
and has created quite the brand following. And so for me, right, when that opportunity came across my desk, I was like, this is a chance for me to really learn about, what makes the greats in psychiatry like great. And I could have just taken a job anywhere else and like, made money, gone home, whatever. But I was like, okay, this is a chance for me to level myself up where I can learn media from Amen clinics. I
Hmm.
can learn integrative psychiatry, like learning about the brain and learning about how to use supplements and lifestyle interventions, all of that, because quite frankly, I hadn't done much of that in residency training. And I can learn about business because I can learn about how like a successful private company can be made even in this field. And that will give me a much higher ceiling than if I just took a job at a academic center. So it's like all those factors for me combined, and I felt like it was just a really good fit, and I still feel that way.
Yeah. It's what you say. It's integrative.
It's integrative, yep.
Yeah.
You
That's
integrate all those things together, yeah.
that's fascinating, man. Well, then let's dive into that. So, what is it about MN clinics that's separating them from the pack of what, so to speak, what the traditional psychiatric model is, and then what you guys are doing?
Yeah. So the traditional psychiatric model is like patient comes in, I get all of their symptoms, and then I make a diagnosis and I prescribe a medication. At the Amen clinics, every patient that comes in, they get a 2 hour long history that's done by a
Okay.
historian, like
Oh,
2 hours
wow.
long. So they go really deep into it. They get psychological testing. They also get brain imaging, SPECT imaging. Now, when I, as a psychiatrist, see that, when the patient comes to me, I have all of that data. So I don't need to spend an hour gathering history.
It's just their
It,
fingertips.
it's all there for me.
Okay.
And, blood work, other things, it's all handled. So that way I can practice at the top of my license, right? I can use my critical thinking, which is creating a treatment plan for the patient, because that's where my expertise is, not just gathering information. And I get 2 hours to do that, just for
That's
that.
awesome.
2 whole hours,
Aside from
yeah.
that 20 minutes that we talked about.
Correct. So we get 2 hours in the initial patient. So I can go over their brain scan results with them. I can go over all of their symptoms, anything if I need to address them in more detail, like I can get into. And then, for example, let's say you were in my practice, right? Like I would say, okay, these are the supplements that I think would help you, but here's the diet that I think would help you. Here's the exercise that I think we should do. Okay, let's talk about your sleep. How is your sleep? Oh, you're only sleeping 6 hours. Well, like let's bump that up to 8. Let's also start tracking your sleep. Let's get a detailed blood work done, more than your primary care doctor has done. So let's
Huh.
look at things like magnesium, zinc, testosterone, iron, a lot of those things your primary care doctor won't check because they're only checking for level one basic stuff, not deeper and deeper stuff. Like food allergies, I do food allergy testing on my patients. I do omega level checks on my patients. So basically checking for other nutritional things because your energy deficit could be from, let's say, an iron problem, for example, right? Uh, so I
I know
get
us
to do
broke people
all of that.
are very deficient in iron sometimes.
Yeah, yeah. So I get to do all of that stuff to help patients rather than just like, okay, here's a medication because I have much more time and the infrastructure is set towards it. And so then that way that when the patient comes back, like I just had a patient the other day, 29-year-old lady, she's bipolar disorder and she didn't want to go on medications because she's worried about weight gain. She has bipolar too, so it's more milder form. And so I was like, okay, well, in that case, like, we should be on a ketogenic diet because that's the most mood stabilizing diet. Like that's what works for epilepsy, which affects the temporal lobe, and that's what bipolar disorder does too. Affects the temporal lobe. So therefore, that's the keto diet would be the most mood stabilizing one for you. Comes back a
This
month
sounds to me like
later
it's.
and
Oh, sorry.
comes back a month later and she's like, my depression is gone. Straight up said that.
Wow.
And so, like this stuff works,
Yeah.
right? Because the whole underlying premise, and I agree with the treatment model as well, the treatment philosophy, the whole premise is that symptoms of depression, anxiety, hallucinations, um, they're all symptoms of a defunct brain. Like the brain is not functioning properly, just like symptoms of chest pain or wheezing are symptoms of a heart not functioning properly. So if we can fix your heart function, then you're not going to have those symptoms. Similarly, if we can optimize your brain function, then you don't have those symptoms either. And so I really like that approach rather than just targeting symptoms from that perspective.
Yeah, it's treating the actual organ versus treating the symptom cluster. That's what it is,
Exactly.
right? This sounds like you are going in a direction that it might be. I don't know how you personally would describe it, but if it's like holistic psychiatry or it's even maybe becoming its own niche field because you're bringing in so much data from so many different disciplines like genetics, past, this is the psychological part, like past like traumas and stuff, hormones, it sounds like, right? You're asking to get their blood work done. It's extremely comprehensive. I'm curious, when a patient walks in, before they even sign up with you guys, do you talk to you guys and say, okay, before I even come in, I have to get this done? Like, what are the steps?
So a patient will come in and they'll have their full assessment done. So they'll have a historian meet with them. They'll go through psychological testing. Basically, it's like neuropsych testing to determine people's cognitive domains, like how's their thinking, cognitive flexibility, recall memory, working memory. They'll get their brain scans done. And so when all of that data is compiled, then it all comes to me. And then I look at the data and then then the patient comes to me. So I make a judgment call of what I want to ask about, what topics I want to discuss with them in more detail. And then, I can start formulating their full treatment plan, whether it's medications, supplements, lifestyle changes, therapy, um, other non-pharmacological things like hyperbaric oxygen, EMDR, right, neurofeedback, any books that I recommend them to read. What do I recommend for them socially, spiritually? Essentially, it's combining, like you said, all these data from different disciplines to provide an integrative approach to psychiatry.
So I know that I actually read Dr. Amen's book, Change Your Brain, Change Your Life. And I know you guys have it sounds like it's this innovative imaging technology called, is it called SPECT, SPECT? Could you unpack like what SPECT exactly is and how it works?
Yeah. So it's a type of imaging. It's called functional imaging. So what makes this different from a CT or an MRI is that a CT or an MRI looks at brain structure, whereas SPECT imaging or a functional MRI looks at blood flow or function. So the difference there is that with functional imaging, you can look at stuff a lot more nuanced, and stuff that doesn't get caught in a CT or an MRI gets caught in an fMRI or a SPECT image. So because those look at blood flow. So for example, let's say you have ADHD and you're struggling with those symptoms, right? An MRI is not going to show that. But on a SPECT scan, I can see that there are, for example, there might be blood flow deficits in your frontal lobe. And so, I can show the patient like, hey, this is why you have these frontal lobe or you're having these ADHD symptoms because, you're having frontal lobe deficits. Like clearly there's blood flow that's not reaching your frontal lobes, which is the part of the brain that's responsible for concentration, focus, impulse control, judgment. So now the patient looks at them and they're like, oh my gosh, like that explains me. Like that's exactly what I've been going through, but no one like fully understands. Like, thank you. And so what that does is that helps one, it helps the therapeutic alliance between the doctor and the patient, which is one of the most important factors for patient success. It helps because it helps the patient feel validated. And then it helps create motivation for treatment because now you have an image. So when you look at this, it's like, like that's why you do, for example, when you have a baby, like, the mom knows the baby's in there. Mm-hmm. But everything changes once she does the ultrasound at 13 weeks and she sees that heartbeat. So it's the same thing with the brain. And then once you see that, then you start being motivated to care for that brain. Like I'll give you an example fresh off the press. So yesterday I was debating on watching I was debating on watching a movie. Like I was like, okay, maybe I'm gonna go. I have the unlimited membership of the movie theater, and it's a couple blocks from me. And because something I love doing is like going to the movies and eating popcorn. Like that's like one of my guilty pleasures. And so, but I was like, no, I can't do that because today I knew that A, I wanted to work out. B, I knew I need to do this podcast. And then C, I have a social activity later today. And so I was like, no, I need my brain to be sharp for all of these things. And eating popcorn, greasy, processed kind of food is not going to be conducive to me showing up at my best for all these things. Right. And that's because now I start thinking about, my actual brain. And I'm like, okay, I need this organ to function as optimally as possible.
That's fascinating.
Why? Yeah, there's a lot there. Yeah.
Yeah.
Yeah, no, there's a lot to unpack for sure.
Actually, it's funny So my first podcast, I interviewed an interventional radiologist as Dr. Gadadra, Anish Gadadra here at UPMC. And he's an interventional radiologist, but he's also the director of UPMC's 3D printing program. And something he's told me is that what they'll do is they'll take the CT scan of a patient and they'll create a 3D model of their whatever organ. It can be their heart, it can be their kidney, it can be their spine, but it's going to be a 3D printed, 3D life-size, accurate 3D model of their organ, and they're going to use that as a surgical guide to guide the surgeons into when they're doing surgery, insofar as even how to even go into the actual organ itself. Like they can make stuff that's like you can take off a piece and that's where the tumor is, kind of thing. And he told me not only does this help with like the actual surgery, but there's something that clicks inside a patient's mind when you give them the actual model and they can see like, oh wait, this is what you guys are going to do. And it helps helps alleviate a lot of their concerns when the like you said, it augments that relationship between the physician and patient, that patient physician alliance. So it's really interesting that you said that's also happening in your practice at clinics with the brain scans.
Yeah, like I'll give you another example. So I had this 30-year-old guy come in, and what he was saying was that his mom had made him get the evaluation done because this guy was getting angry. He was like raging all the time. He couldn't focus on anything, couldn't hold down like a consistent job because he'd get mad a lot.
Mhm.
He'd punched a hole in the wall, and like that's when the mom was like, okay, like you need to go get assessed right now. So he gets assessed. And so this guy is a boxer. He's a boxer by day, like he's trying to train, become a professional boxer. And at night, he's a bouncer. And so what the mom was saying was like, it's the boxing, like it's the boxing. The boxing's messed up your head. And the patient's like, no, it's not the boxing. It's not the boxing. So I have his brain scan and I show it to him. Mom's not there. It's just him. And so I show him the scan, and in the scan we see these holes of like it's blood flow holes, but it looks like holes in his brain all over. And he's just like looking at it, he's staring at it, and then he looks up and he's like, "Don't tell my mom, but she was right."
Wow, that's crazy.
Immediate, right, right.
Yeah.
All the telling in the world, you just show him that one image, it changes everything.
Like, if so, here's my next question though. This imaging technology sounds like it helps pretty much all your patients coming in, like 99.9%. And it changes the way they think about their mental health. So my question to you is, as far as I know, I'm in clinics as the only one doing this kind of imaging. Why is it this not ubiquitous among other like psychiatric clinics?
Yeah, that's a really good question, right? So there's a couple things. One is that it's not necessary for every patient, right? It's a tool that helps us. So just like your
Okay.
CT guided thing, right, with your interventional radiologist, like you don't need to do it. Just like any other clinic that has like wellness stuff, like like liquid IVs and stuff, like you don't need to do that. You can just drink water. But people want that premium experience, right? So from a business perspective, when they come to us, they feel like they're getting that premium experience, the premium tier, not the bronze tier or the silver tier of mental health care, because they're
Platinum.
the platinum, right? There's definitely tiers to this, right?
Okay. Okay.
So just like there is for anything in life, you want a Honda, some people want a Honda, other people want a Ferrari, right?
Okay.
A Ferrari is not necessary to get you from A to B,
Right.
but people want it.
Mm.
So that's one thing. So it's not ubiquitous because it's an expensive technology, right? It's like why aren't Ferraris ubiquitous? So there's that reason. The second reason is that there's a lot of controversy behind it. So, uh, for example, it's expensive, right? So because of that, our evaluations are pretty expensive. And so I know Dr. Amen in the past, he's gotten a lot of flack, a lot of grief for uh, these clinic doing those evaluations when they're not necessary, like absolutely bare bones necessary. And so I can understand where that comes from, right? I don't think every patient needs that, but it's that premium tier, right? You get or that platinum tier. It helps a lot of people with motivation, and for some patients, it really can change their treatment outcomes. So, for example, that TBI patient, the boxing patient that I mentioned, I had another patient who was playing a similar case that was playing lacrosse, and he saw the same thing. And I talked to him a month later, and he said he was at Yale playing lacrosse. He said he quit. He quit playing lacrosse. He's like, I'll go play golf instead because it's not worth like my head damage
Yeah.
just from
Probably
seeing
changed the
that.
trajectory of his life.
Literally changed the trajectory of his life.
If this is the Ferrari
Oh, and
of
another
oh,
thing. So this is my personal opinion, but
okay.
I think that quite frankly, a lot of people are just jealous of how much money the
Yeah.
clinic's made, how much money Dr. Amen has made over his career
Yeah.
with this. And for example, if this was a university kind of thing, like it was like a cool thing that he was doing in universities, then there wouldn't be controversy. But
Interesting.
because there's money being made, that it draws
There's
attention.
controversy.
There's
Interesting.
controversy.
Interesting. Oh, so my
That's
question
my
is,
opinion.
Yeah, yeah, no, and that's fascinating. And so that kind of goes well with the question I wanted to ask you. If this is the Ferrari of mental health like treatment, uh, how accessible have you guys made any efforts to make it somewhat accessible to the average person, just so like they can get a taste of it as well?
Yeah, so I just had a patient, a 20-year-old guy, and he's had severe OCD. And this guy has tried a whole bunch of medication. It hasn't worked. He's kind of been off and on. He's been smoking marijuana for a decent amount of time. Um, and he was just, he's been kind of like this forever and ever. He gave an example of he ran for or sorry, he was in a fraternity and he ran
Okay.
for vice president. And so he didn't get it. And the reason he didn't get it was because his fraternity brother said he was way too uptight. And they gave an
Huh.
example of like one time they threw a party and it was like 30 minutes before the party or something, or maybe just the party started and no one had showed up. So he canceled the party. And then like
Mm.
people end up showing up later and they're like what happened? They're like, oh yeah, we canceled the party. And like he
Yeah.
canceled it because,
Mm.
he was just like, so in his head, so anxious about the thing. So he's like, yeah, there's consequences. He said he can't go into his job fair because he's overwhelmed by how many people there are. And so that's impacting his ability to actually find, a job after college because he can't go into the job fair and talk to recruiters. So with him, we have a thing called the foundation where basically it's like, the charity, we have a charity and the charity can pay for him. So I offered or I put him up as a candidate for this. And so they accepted. And so now this guy got his full brain scans, like the full treatment, full evaluation done for free
That's
because he became
fantastic.
a foundation patient. He's a
That's
college student.
awesome.
Like I'm literally going to see him next week, and then I'm going to go over his scans with him.
So is it that first appointment where you go over the scans, or do they have to? It is a first appointment,
First appointment, yeah, 2 hours with the psychiatrist.
2 hours. Right? Certainly sounds like you're getting it to me at the very least, my personal opinion. It sounds like you're getting your bang for your buck. But I guess that comes with like a platinum tier service, I guess, if with the M and clinics.
Yeah, people want different stuff, right?
All right. Yeah.
Yeah, the type
So
of
I
clients we see are
yeah.
different than the type of clients that, a community mental health sees
Mhm.
or like a college program sees, right? Like there's just different things for different people.
I do notice that a lot of not maybe you can tell me how accurate this is. I do know that there are Dr. Eman has treated a lot of like celebrities and stuff, which makes sense because they have the money to afford a lot of these services. Has that have you ever had to treat anybody well known? You don't have to say names, obviously, but like you could. Yeah, but have you ever had to treat anyone well known? And has anyone showed up at the New York office?
Yeah, so I've treated some NFL players. That's been the
Nice.
the main one. Yeah, that's the main one that I've treated. Uh, in terms of celebrities, I think most of them are on the West Coast. So no one that I've personally treated that is like a big well-known celebrity. But I'm also only 6 months in, right?
Oh
And
wait,
so
so I didn't know you were 6 months in.
yeah, I joined in July 2024. And so when as my brand grows, and as my experience grows, then I'm sure that will happen as well.
Well, I'm gonna do my best from my side to help your brand out, man. You know, I'm curious when you is it did you have this integrative perspective or philosophy of looking at psychiatry before you joined MN clinics, or was it afterwards?
It's both, right? Like again, it's the nature versus nurture, right? Like if you have a fit for that level of thinking, then that's what draws you in. So of course I already did, right? Like, I've been working out since I was 22, so I was already into physical fitness, nutrition. Like I knew about sleep optimization. Like I knew about social life optimization, right? Through dating experiences, dating coaching, like pickup, like all of that field, right? So I'm like integrating those different aspects. I remember that when I was in my first year of residency, uh, I was working in the inpatient psych unit, and a patient come in, and so I was first year resident, and the attending's like, okay, I'm gonna watch you do a history, and so I'm doing the history, And then, at the near the end of the history, like the patient starts crying, right? And like not in a bad way, just like crying, discussing her stuff.
Yeah.
And then she leaves, and then my attending looks at me, and she was like, "Wow, like you made that patient cry. Like you drew that emotion out of her and all that information. Like now she trusts you." And it's very rare that I see a first year resident do this. And so she's like, "How'd you learn that?" And so, what I told her was that, when I was young, I used to practice going up and talking to girls. And like that's how you learn social skills. So similarly, right, like I'm integrating that experience, that empathy, that skill set that I developed into psych.
That's fascinating. So, guys, if you want to be a awesome psychiatrist, just go to your nearest pickup boot camp right now. Just,
I
but
mean,
no,
that shit
that's.
has its own problems, but yeah.
I know it does.
Yeah.
I know it
I mean,
does. It,
importantly on this point, right, the bigger idea behind that is that, you are in control of your thoughts, your feelings, and your actions. Like that's basic CBT. So in that, like that talking example, right? Like I'm in control of what I think. And then because of that, I'm in control of how I feel. And then, if I'm in control of how I feel, right, I'm in control of how well I can listen, how empathetic I am, uh, how charismatic I can be. And so, because I'm in control of all that, then I'm going to control my actions. And then it's a whole feedback loop. So, then by developing that skill set there, I'm able to apply it into different areas and apply that type of thinking into different areas of my life.
did you learn that skill? Like, when did you do the pickup boot camp? Did you do it like after medical school, like during residency, or no? This was before.
No, no, this was before. I didn't do like a boot camp and stuff. Like I would just like would practice like at my
Oh, you
college
practicing it.
campus. Yeah, like literally just on my college campus. Like I remember one time, I think there's like I was with like a friend or two, and there's like a maybe group of three or four, and I think I just met him, and I went to like give them all a hug or something. We just met, like just new people, and it came. I just remember it being like a very awkward moment, and it was
Yeah.
very uncalibrated, right? Like I
Mhm.
was 18 at the time, but it's like going through the reputation, and like you feel that sting, that you feel that burn, that you take that feedback and you learn from it, and then you
Yeah.
apply and you get better and better at whatever skill you're pursuing.
Absolutely. So I know now that we've kind of established that MN Clinics has like a very unique treatment methodology that's it's bringing to the field of psychiatry. But I also know that you, in particular, have a unique treatment philosophy as when how you like to approach psychiatry. So what I mean by that is, and if anyone wants to watch this, go on MN Clinic's website for the New York location, and they have meet the physicians videos. And in one of the videos, and tell me if I'm wrong, but in one of the videos, you talk about how the way you like to approach treatment, like to approach life, is kind of like you you treat it like a video game in a sense that you're learning skills that are going to help you in life and in the context of your psychiatric treatment. You learn skills that are going to help you overcome this disorder or this illness. Uh, where did you come up with that treatment philosophy?
Yeah, that's a good question. So I remember so as a kid, I was always a gamer, and one of the games that I used to play was Pokemon. So to play Pokemon, if you're familiar with it or not, basically you start with like level 5 Pokemon, and then you catch other Pokemon, and then you go around the world beating gym leaders. And then as you go fighting gym leaders, your Pokemon level up. But then the gym leaders get stronger, so then your Pokemon have to get stronger, higher levels to beat the higher level gym leaders. And then you just keep progressing through the game, and you get to the Elite Four, and they have a lot of challenging Pokemon there. So you have to make sure that either your Pokemon are good enough to fight them, or you have to go and train them so that way they can be a high enough level to beat those gym leaders or the Elite Four.
Yeah.
And so like I've spent hundreds and hundreds of hours doing that. And then when it comes to real life, like I remember I just kind of over time I started having the realization. Well, the realization came was when I would see people spending like hundreds of hours, like grinding in the games and uh, getting things that didn't ultimately matter. Because like when I went off to college, I was like, okay, I could be a Pokemon master in the game, but now I look at this in my real life and I'm shit. So
Yeah.
all this time I spent grinding in the game, I could have spent in real life. And then it just like hit me like, well, like life's kind of like a game like that. Like, as you start working out, you get better and better at working out, right? And then your stats improve. Same thing social wise, right? Same thing diet wise, same thing career wise. You get better at studying. And so all those things kind of stack. And I was like, this is like the perfect analogy for real life. And so as a gamer, like I really identified with that philosophy, and I guess that's how I think about life, even today.
How do you, when you're talking to a patient, how do you communicate that philosophy? How do you like teach them?
So
Is that something
it's
you consciously even bring up?
yeah. So it depends on the patient, right? Many patients, it's not like I bring that up, but some I do. So for example, I had a 20-year-old kid, and he was being seen, or his mom came to see me because of gaming addiction. So this kid had a laptop, and the laptop that he had, basically he would spend that night gaming, then he'd wake up in the morning, he'd be late to school, and he would just be uh like not doing well, hard to get out of bed. And the mom was like, okay, what's happening? So they found out that he had a laptop, so they took away the laptop. The kid had autism as well, and uh then the problem still persisted, and they're like, what is happening? Why is he still struggling like this? Then they found out that he had a second laptop.
Got the backup.
Yeah. So the family takes away the second laptop. Kid punches dad in the face.
Oh my God.
So that's when they came to see me. And so, with this kid, like I remember just talking to him, and like for him, he was a gamer. And so like I explicitly like kind of like told him that philosophy. And like, the mom was sitting there, and like the kid was sitting there just listening. And, I could tell that he was getting it. And the mom was like, whoa, like I've never heard anyone like connect with him like that before. So that, and now like this kid, I just saw him 2 or 3 weeks ago. Now he's like working out with his dad in the basement. He has strict like set times when he games. He's sleeping a lot better. The parents are actually going to kick him out of the house before, but now they're not doing that. They say that he's more motivated to help. Like the dad will ask him for help with like mowing lawn or something, and he'll be like, yeah, sure, without any complaints. So he's making a huge turnaround in his life. And, I think part of that is just like, so I told him like, well, do you want a girlfriend? And he's like, yeah. I'm like, well, are you at the level of a girlfriend right now? And he's like, well, like, I don't know. I don't think so. And I'm like, well, okay, like, then you just got to level up. Like if she's here, you're here, you got to get here. Right. And so like that level of that type of philosophy really worked for him. But it's not something I use with every patient. If a patient's not a gamer, it's harder for them to uh, get with that philosophy. But by broadcasting that philosophy, how I think, then the people who are more drawn to that, drawn to me, drawn to my approach, will naturally find me.
You're filtering your patients in a
Mm-hmm.
sense. Who could be the most suited to you and get the most effective help from their psychiatrist.
Absolutely. Yeah, like I'll tell you another story. I remember I had in my residency, I had a patient. She was maybe mid 30s. She was having postpartum depression, and so for her, I distinctly remember, I'm able to help her with like medications and other stuff, but I just distinctly remember feeling like this is an experience that I'll never understand. Like I'll never understand what it's like to give birth and to have all that hormonal rush and to feel that crash of hormones afterwards, right? To feel that responsibility of being a new mother and like not sleeping. Like I can empathize with it, right? I can put myself in her position, but I'll never truly have that deeper level of empathic like resonance, right? That comes from actually having that lived experience. So similarly, I realized I was able to, if I can connect with the patients more personally, I can help them get better outcomes. So it makes more sense for me to have patients who resonate with the way I think.
That's great. I'm curious, what were you, so aside from Pokemon, what were your favorite video games growing up?
So I used to play a lot of. There's a game called Monster Hunter. I used to have a Nintendo Wii. I don't know if you're familiar with that.
Dude, that's my favorite game.
Oh, really?
Dude, I can't, I think Monster Hunter Wilds is coming out in February, and I
Uh-huh.
cannot wait.
Yeah, it's coming out real soon, at end of February, I think.
Oh my
Yeah.
God, I didn't know you like Monster Hunter. That's funny.
Yeah, so there's one. It was called Monster Hunter Try for the Wii.
That's what I started on.
Yeah, that's what I played
That was
too.
my first one.
Yeah, I think I must have put like 200 hours or something into that. Yeah,
That's
but
fantastic, man. What was your favorite monster to fight and try?
oof. If I go back, I remember fighting the Rathalos a bunch.
Yeah.
That one. I remember I think one of my favorites. So there's like a poison monster. I don't remember what it was. It was maybe like two-thirds into the game, and
Does it live in the snowy Giganox? It's the worm one.
Giganot. Yes, a worm one. It's like in a cave or something.
Yeah.
Yeah, I remember that one was a good one too because I think the armor you got from that was really sick, and so I remember recruiting a party to fight the
Hmm.
Giganox a bunch of times. There was one that was an event one where it's like you like sail a ship, and then you're like shooting like cannons, I think, across this
Yes.
monster in the sand.
I'm a complete nerd about Monster Hunter. Sorry for you guys. You guys might need to block out this part of the video because you guys don't know what we're talking about. But no, it's this whale called the Gem Moran. So it's like a sand whale, and then you
Sandwell,
fight.
yeah.
Yeah, I can remember the monster on the cover art. It's like a sea serpent. It's
Mm-hmm.
that conducts electricity. I can't. I
Yeah.
remember that thing kicked my butt like so many times trying to fight it. But actually, it was funny that us liking that game. That's also another game that's very applicable to your philosophy. Where the premise of the game is you're killing you're this mercenary for hire and you're killing these monsters and you're helping like this village out. But you start with like the lower tier monster and usually some kind of like thing, and it's
Jaggies.
the Jaggy. Oh my god, I love the howls that they do. I love the speculative biology in those games
Yeah.
and how the directors, the game creators, they make like an ecosystem. I love that stuff because I used to watch Animal Planet as a kid. Uh, but like I was saying, you start off with these lower tier monsters, and it's tough because you might just be dressed in literally like your underwear or like literally like your underwear. It just looks like that's all you have, or like some undergarments, and then you level up to get like actual armor and chainmail, and then you can finally fight the jaggy like the raptor monsters. And then it's like the next one is like even bigger than that, and then the next one's gonna be bigger than that, and then you have to find ways to level up your skills. And I think the cool thing about that game is like there are actual skills and stuff, but it's actually you have to get better at the fight itself and like learning it.
hmm There's multiple levels to that. So you have to get better at the fight itself. So that's like the mechanical skill. You also have to get good at, you just have to get good armor. You have to get good stats, right? So you have to level up those stats from the armor that you have.
Yep.
Uh, you have to work together as a team. So that's a skill, right? Like you fight a monster way better as a team than an individual. Just like in real life, you're probably going to do better working with a team rather than by yourself, right? You have to grind that monster over and over again to get the armor for that monster because that's how you get the
Mhm.
loot for it. And so just like in real life, you have to work out a few hundred times before you're going to start noticing gains. You're not going to notice them in the first like 5 or 10 workouts.
Mhm.
So it's a similar, yeah, super applicable concept. And then it just keeps scaling up and up. The game doesn't get easier. You just get better.
You just get better. I remember. I'm sure. Tell me if I'm wrong. There are a couple of times where you have to make that one armor piece, and it requires like a specific piece of the monster, but it's the percentage rate at which you might get that one item is like 1%
It's
or
like
2%.
10% or something.
It's
Yeah.
10%, and like you have to fight this dragon or this sea serpent like 5, 10, 15 times. I remember, I swear
Yeah.
to God, I fought this dragon like 15 times, and I until like the 20th time, I got this one part for this one piece of the armor that I can finally use to fight the next monster. Uh, and of course, it was a grind, but similar to when you're working out in the gym and you don't see the results until you actually look in the mirror all of a sudden 15, 20 sessions in. 15, 20 sessions in, I realized that I'd actually gotten very good at fighting this particular fight. And so then whenever I went back in, I was like, oh, this is a piece of cake. Like, because I memorized the moves, I memorized where it eats, where it sleeps. Okay. Yeah,
hmm
that's so funny that you also played that game. It's one of my favorites. Are you going to get I know you're extremely busy professional, but I'm curious, are you gonna get Wilds when it comes out?
I'm not, no. Dude. Those one of those games that you can just sink forever into. So like I remember when Monster Hunter World came out, like I really wanted to play it. I was in my fourth year of med school, and I was like, yeah, I'm gonna play this game, like because especially after interview season and applying for residency was done. I think it came out like January 2019, if I recall.
Yeah.
And so, but I never ended up doing it. Like I just found other games to play instead, and then started residency, and so now I'm like, well, now honestly, there's too many games and not enough time to play them. Like I sometimes I wish that I could freeze time and uh just to game. But that
Yeah.
leads me to another realization actually. So especially talking about gaming addiction. Last night this just happened to me. So I was saying that like I ate a pretty healthy diet and didn't have that popcorn. I find that when I do that and when I sleep well and when I exercise, which I did all those things, I don't even want to game. Like
Interesting.
I don't even want to do it because I feel like that's time I'm wasting that I could be productive. And like it's not even like a logical thing, it's like an emotional thing. It's like I don't even want to, like I don't feel compelled to do it. But let's say I haven't slept well,
Mm.
or I might have drank the night before, I have a little bit of a hangover,
Yeah.
or um I eat crappy food, then like I want to do those instant gratification dopamine things, and it's really hard for me to motivate myself to work out or to do like work on a project or work on like any other productive thing. So
It's
and
interesting you
that's
say
just
that. I've had similar experiences. So I
mhm,
don't play games as much as I do now. I don't play games as much as I used to because busy got a podcast, writing a blog, playing school. So I actually had my Nintendo 3DS to play some of the those Monster Hunter games, but I haven't touched it in like actually like almost like a year. I just haven't picked it up just because I've been so busy. And when I take care of my diet, when I've been working out consistently, I also notice that I don't. For me, it's my phone actually. That's actually the big one. Is like watching YouTube and going on like a YouTube spiral. I noticed that when, especially like if I had like a night out where I was binge drinking or something like that, and I would fall into like a YouTube spiral when I come back home, and then it would be like 1 or 2 o'clock in the morning. Like, why didn't I go to bed?
mhm.
I completely relate. And actually, it's interesting. So when you mentioned gaming addiction, so I actually was wanted to ask you about video game addiction. So I think I read a study in so in 2021, it was found that the worldwide prevalence for video game addiction, so worldwide, about 3.3, anywhere between 3 and 4% of um 3 and 4% of video game users suffer from video game addiction. So that means that I forget actually how many video game users that it was worldwide, but it's a lot. But they said the research study said that it was 60 million people are suffering from gaming disorder, video game addiction. And according to there was a Pew Research study, and they said that 50% of about like 52% of gamers are male, 48% are female. But in but they noticed that it was majority of the people who were suffering from the disorder were male rather than female. So it goes back to our earlier conversation about how gender can play a part in the mental health disorders that you experience and might even suffer from. So my question to you is I can understand getting addicted to maybe alcohol or heroin. But even though I've heard of video game addiction, it never occurred to me that you could get really addicted to it. I just can't wrap my head around it. Why are video games so addictive? Why can they be so addictive?
Yeah, so with alcohol and other things, right? The main chemical that they spike in our brain is dopamine.
Mhm.
Dopamine is the pleasure neurotransmitter, and it's also the motivation transmitter neurotransmitter. So when you, for example, vape nicotine or cigarettes or heroin, it causes a spike of dopamine, which causes pleasure. But then when you have that crash, it has you seeking out that again. right? It reinforces that behavior. That's the whole purpose of that molecule. So ideally, when you do something healthy, like let's say you work out, you feel a dopamine spike from that, then you feel that desire to do it again because that dopamine is reinforcing that behavior, right? So but that substances hijack that. Now, video games release dopamine. They spike dopamine, and they in fact are curated to do that. It uses a principle called intermittent variable reinforcement, where basically, if you're familiar with the slot machine, right? Like,
Yeah.
let's say you're pulling on the slot machine, and you know that every 4 times you're going to get a hit.
Right.
By the 12th time, like, you're going to quit the slot machine
Right.
because you know it's going to come. So now
It's
you're
just
not
a
going to
matter of
get
how
that.
many times I pull the lever.
Right? It's very
Good
linear.
work.
But now the reason that slot machines are addictive is because you don't know when the reward is.
Uh,
So sometimes the reward could be like hit 2, then let's say hit 6, and then hit 20. And you don't know. But now because you're reinforcing that motivation from the dopamine, you keep on pursuing it. Games are designed to hook us. Phones are designed to hook us. Social media is designed to hook us. That's literally how they make money. Like that's the model. So a
do
game
these
is
companies
designed.
get like oh, sorry, sorry.
Yeah, so they do get psychologists
Yeah, that's
to do that, right? Because that's literally how they make money. So it's an incredible investment for them to do that. We know that food companies, they get food psychologists to make sure that the food tastes as intricate as possible, the sweets and stuff, to make
Yeah.
sure that we want to use it as much as possible. So in a game, you're familiar with the game, right? You don't, like you said, we are talking about Monster Hunter. You don't know if you're going to get that loot, that rare loot, on the first try, on the 5th try, on the 12th try.
Right.
So it makes us fight that monster again and again.
And again, yeah.
And then, you get that feedback loop, right? There's, you fail a couple times and you beat that monster, and you know how great it feels when you beat the monster.
Oh yeah, there's music playing, like you
Mm-hmm.
did it, right? There's like a
Correct.
ka-ching, like when you open up the reward and you're like, oh, you get all the scales and stuff. Yeah, so that
You see
all
it?
plays. It's like a slot machine,
It's like a slot machine. Yeah.
huh? I didn't think about it like that.
Mm-hmm. So like they're designed to do that, right? That's why they're so fun.
Did you ever have a video game addiction, or if not a straight on addiction, like you could feel it kind of creeping on the edges of like potentially going to develop?
Yeah, so like, as we were saying, I used to play a lot in high school, and like I had this routine where I would come home after day or after school, and every day, like I remember being in my like geography class like right before school, and all I could think, or right as school was ending, and all I could think about was just gaming. Like I just want to
Right.
go home and game. Like I remember thinking about like Fallout. I used to play Pokemon on my GameCube. I was like, literally just think about those games, and then I would go home, and then I would grab a plate of Oreo cookies. So like not just one or two, but like a literal plate. Like I would put them all on a
Okay.
plate, and then I would go downstairs, and we had a big TV downstairs, and I would shut off all the blinds. I would close the door, and I would literally just play. And then I would play downstairs, um, and then I'd probably come up for dinner. But then after dinner, I would go upstairs. I had a PC in my room, and then I would just game, until nighttime, like 12 or 1 or whatever, and then go to bed. And so I kept doing this for like years. And like, I didn't go to any parties. I had a couple friends, but I didn't like spend that much time. I spent a little bit of time with them, but like not that much. And then I remember that there was a girl I wanted to ask out to prom, but like I was too scared to ask her. Like I was like, oh, I'm too scared. Like, oh, what if she says no? Like that kind of stuff.
Right.
Um, and then this other guy asked her out.
Oh no.
Yeah, and she said yes. So I remember like being like vividly remember being at prom, and like seeing this girl that like I wanted to ask, but
Mhm.
now she was dancing with this other dude. And so I remember sitting there, I was like, oh my gosh, like, and and so I just had that realization where I was like, okay, like things have to change, or else my life is just gonna be this way.
I can't keep killing the gem brand over and over again. Like this has got to stop. It's as addictive as it is.
Yeah, so I remember like reading like a social skills book actually. It was something like it was like a college game book or whatever, like on the like in the summer before college, because I was like, okay, like things got to be different here. I can't keep on doing
Yeah.
this anymore. And then that started the whole college journey. And like I didn't bring any of my game consoles to college because I was like, okay, I'm gonna just like throw myself in socially and focus on that.
Like you said, though, it was it's recognized the problem and you executed that. I'm assuming seeing those results in your own life versus a video game, was that even therapeutic for you?
hmm Yeah, absolutely. And so, that's right. That helps just thinking about it because now it's like real. It makes real life fun. It's like I'm always gaming in real life.
Hmm. When a patient comes into you with a video game disorder, like what are the first steps that you ask them to begin the process of fixing that disorder? And you mentioned that one patient who was autistic, and I'm sure that probably exacerbated certain aspects of the video game addiction. But the average person who comes in with a video game addiction, like, well, I'm curious what you would start as like their treatment plan.
Yeah. Well, so the first step is establishing what we call a therapeutic alliance. So what that means is developing a relationship with that person. They've done all these forms of therapy and they've found, right? There's like they've done studies, okay, what's better, CBT, DBT, psychoanalysis, whatever, and the patient outcomes are about the same.
For all of the
They're
therapies,
yeah, they're all the same.
really? If there are different therapies, I'm sure there are different therapies for different things, right?
Right.
Okay, interesting.
But the benefit that people get on just comparing general therapy modalities are about the same.
Interesting.
The reason is because it's not the type of therapy that matters. Like individually, of course it matters, but from a macro scale, that's not what matters. What matters is the therapeutic alliance between the therapist and the client. The stronger that relationship, the more that person's going to be motivated to make change, the more they're going to trust their therapist, the more they're going to be honest with them, the more they're going to keep coming back. These factors matter which more than like what kind of therapy you choose.
So, how do you build an effective therapeutic alliance with your patient?
Right. So now, right, it starts just like we did, right? We talked about Monster Hunter. So boom, we established a point of commonality right there. You make sure that the person feels heard, you feel seen. That person, that patient, you're probably the first person who's actually listening to them empathetically and non-judgmentally about
Right.
gaming. Because everyone else, their mom's like, you're gaming too much. Dad's like, I'm taking the games away. I'm shutting down the internet. Like, it's a problem. Get rid of it.
Yeah.
But they're not understanding what the game's doing to the kid or why they even game. Do they game because they like the achievement, like we liked in Monster Hunter? Do they game because they enjoy the social aspect? For example, when I played Call of Duty with my friend after school, it's like we were hanging out. Or we played Smash Bros, right? Do they like the sense of adventure? Kid might not get to travel that much, so now they get to explore this whole video game world. Do they like the achievement of, okay, I get bullied in school, but now as a, when I go online, I'm like a rogue level 50 paladin and like I have a party and I'm slaying
Yeah.
monsters and I'm leading raids. Like I'm somebody here. But in the real world, I'm nobody. So you got to identify what is even the reason that they like the gaming. Because then once you identify that, right, then you could find alternative things that could fit that, right? So if the kid like exploring, well, what if you start exploring more with them, like as a family? If they like, achievement or team building, what if they join the chess team? What if they do team building, join some kind of soccer thing or like league or even like real life meetup, board game night, board game meetups, right? So you can find other activities that channel the reason why that person likes those games. Then there's a concept called motivational interviewing, where you help see what a person's motivation is, and you help them recognize that, uh, whatever's going on in their life, if you help them make that change, because a person's not going to make a change, no matter, like, unless they want to. So it's all about helping guide them towards wanting to make a change.
And does this treatment methodology or even this outline, does this also apply for other addictions like alcohol and drugs as well? Is this
Yeah,
transferable?
yeah, of course. There's so many components, right? So that's one of the emotional component, or that's one of like the behavioral components. Environmental isolation is a big one. For example, so they in Vietnam, when the Vietnam War was going on, you may have heard the story before, where a bunch of the soldiers got addicted to heroin, and the U.S. government was super worried that, oh my God, like they've been, using this heroin in the jungles, and now they're gonna come back, and we're gonna have a huge problem on our hands. Soldiers came back, 90% of them had quit heroin, like immediately, and they're
Why?
like, yeah, exactly, like what the hell, like why? In that environment, they were in the jungles. That it was accessible. Everyone around them was using. They come back to civilian life. It's outlawed. There's no access to it. People are just living their civilian lives. They go back to their normal life. There's no heroin. No one else around them's using. So they
Hmm.
stop. The environment is
So,
not conducive to it.
so how big of a part? It sounds like the environment plays a lot more of a role than because it goes back towards this nature versus nurture debate.
Mm-hmm.
So my question is, how big of that how does the environment play a role, and does that overshadow the nurture aspect at times, or is
It's
it
it
more nuanced than that? It depends. It's just depending on the.
Yeah, it's both, right? Like, I told you my example. Um, when I went to college, I just didn't bring any of my video games.
Huh. Okay.
So immediately I was shaping my environment to alter that. So now let's say I brought my game console on my TV. That probably would have made it harder to use that, right? But I didn't have it. So it's like, oh, well, I just don't have it anymore. Now, of course, like I still gamed. Like my roommate had a PS3, so like we would play on it, but that wasn't mine. It was my roommate's, so I couldn't play on it all the time. And plus we were out doing other stuff together, right? Like social activities and interacting. So other activities replaced the video gaming. So similarly, what I was saying before, right? Like finding other activities that fulfill that urge that that video gaming has.
Does this have to do with
Because
other mental health disorders too? Like, can anxiety or depression be, if not treated outright, severely, uh, not severely, can anxiety and depression be majority of this of the illness can be alleviated through a change of environment?
it's hard to say majority, right? It's so
Mm.
dependent, but yeah, I think it has. Of course, it has a huge impact. ADHD is a prime example. Some people study better in louder settings. Some people work better in quieter settings, right? If an ADHD person, let's say you're in an environment where there's like a ton of noise around you, and you have your phone buzzing away, and then there's all the stimulus, then of course you can't work. But now let's say you put your phone away, you make sure your environment is clean, you turn off notifications, right? You put on noise canceling headphones, and now you haven't done anything, you haven't changed, you've just altered your environment to help suit the goals that you want,
And
right?
so, if you were to give
Environment's a
advice to
huge
someone, okay,
environment is
yeah,
a
I was going
huge
to ask.
shaper of
Yeah,
behavior. Yeah.
I was going to say, if you had to give like easy action to implement actionable advice to people to take ownership of their mental health, it sounds like environment's a big part of that. I'm curious, how would
Hmm.
you, what would you say?
So I would say that willpower is a very finite thing, and willpower doesn't really accomplish as much as you think it would. Look at like eating, right? The reason that we binge eat late at night is because in the morning we're all very motivated towards our diets and stuff, but then willpower drains over the course of the day. So when it comes to nighttime, that's when all the bad decisions are made, right? When it comes to alcohol or substances or binge eating or risky sexual activity, whatever it is, right? That's when we make all those decisions at nighttime. So what we want to do is, if you're trying to make any kind of change, is you want to have your environment do it as, and the external factors do it as much as possible. So that way there's way less willpower for you to do it that you need to utilize. For example, I used to have I have a sweet tooth, and so I love desserts and sweets, and like I used to like always have a dessert with every meal. Ice cream, cake, candy, like chocolate, like I would always buy that stuff.
Right.
And then I was like, well, it's not really helping my fitness goals. It's additional calories that I don't need. There's no nutrition. And so, as that stuff started running out, I literally just didn't buy anymore. And now all I have in my cabinet are protein bars. That's literally the only dessert I have. And so, and like fruits and berries. So I'm like, okay, well, if I want a dessert, then I'm going to eat a protein bar. And obviously, it's not the most best thing, but it's far better than like what I used to eat. And it's serving my fitness goals. And now I don't have to exert any willpower in resisting the dessert. I can just make a one-time decision of not buying it, and now I get the passive gains from it.
Would you say also, because you mentioned working out, like when you get the to a major theme in this discussion, so when you get the biological foundation of your health fixed, or at least running on all cylinders, so to
Mm-hmm.
speak, you make the ability to tend with these mental health disorders or even a lot easier.
Yeah, absolutely. Like it's like putting shit gas in your Ferrari versus giving it the premium gas.
Mm-hmm.
Yeah, it's the same concept. Your body's a machine, so you want to optimize all the inputs for it to run as efficiently as possible. And the brain is just one part of that machine.
Absolutely. Agam, this was a fascinating discussion. I think we logged in 2 hours and I barely knew the time was flying, man. Thank you so
Yeah.
much for this discussion. It was really fascinating.
Yeah, man. I'm glad we got to chat.
Uh, where can people find you?
Yeah, so the best place to find me is online. So if you want to connect me on social media, it's Agam Dhawan MD on Instagram as well as TikTok. If you're interested in pursuing psychiatric services, either through my private practice or more integrative through Amen Clinics, then you can find all that on my social media as well.
Fantastic. I'm going to make sure I link your socials and also the video for in the website for Emin Clinics down in the description of this video. Agam, thank you so much for joining me on the podcast. I really appreciate the discussion. It made me think a lot, and I know that a lot of my viewers will get a lot of value out of this podcast.
Yeah, I hope so, man. It was a pleasure.
All right, man. Take care.
Yep. Bye.